You have typhoid. It's very dangerous and you must get admitted to the hospital and take treatment. This is what most of the hospitals keep advising you. That means to say, so most of the hospitals keep using this name typhoid wrongly. Wrongly they use this name typhoid. Wrongly they give you the report of typhoid and make business and money out of it. Let me explain you. So generally, I keep getting two types of patients. So patient number one. So these patients will have high fever. With high fever, they go to hospitals, especially the nursing homes. So where they'll be advised to undergo blood testing. So in the blood testing, again the blood testing will be done in their hospitals. So where it will be reported as typhoid positive. Then they start scaring you. Oh, you have typhoid. It's very severe. You must get admitted in the hospital for 5 days. Then you get admitted to the hospital and you take treatment. So after 5 days, you will be discharged. So discharge bill will range from 50,000 to 2 lakhs, depending upon the hospital. At the end, you will be paying 50,000 to 2 lakhs in that 5 days. Such patients, so when they come to me, they say, sir, I had fever, I had cold, I had cough, as well as a joint pain and tiredness. So after discharge, I don't have fever, but still I have this joint pain, cough, cold, as well as the body pain and tiredness also. So this is one type of patients what I see. Second type of patients will be, so they will be having a high fever. They go to hospital where they will be diagnosed. They will be subjected to blood test and diagnosed as a typhoid and advised admission. And these patients, they don't get admitted. They get some prescription and they don't get admitted in that hospital. So when they come to me, second type of patient without admission, when they come to me, so when I see the report will be having typhoid. It will be showing a high titer of typhoid. So, but still, without starting the treatment, I tell them to recheck this typhoid in another lab, only lab. So when we recheck this patient, the report will be absolutely normal. Same day, so morning when they checked in the hospital, that is in the nursing home, it was showing a typhoid. So whereas in the afternoon or evening, it is showing no typhoid at all. That means to say, more than 90% of the hospitals nowadays, they are creating this wrong report of typhoid and making you get admitted in the hospital and they mint money out of you. So what is this typhoid? Typhoid is a bacterial infection. So what is the cause of this infection? It is because of either contaminated food or contaminated water. So the high rate of typhoid, high titer of typhoid was there so long ago. That is around 10 years or 20 years back, we were seeing more cases of typhoid. So, but nowadays, chances are very, very, very minimal. So because we're getting this typhoid because of this contaminated food or contaminated water. But nowadays, so this contaminated food, no one eats this contaminated food. Contaminated food in the sense which is half boiled, which is not being properly cooked. Such food can transmit this typhoid. But nowadays, no one drinks this contaminated water. Everyone will be having either a filter in their house or they drink the filtered water which is available outside. So even if you drink water in the hotels will be having these filters, or otherwise you will be using the bottled water. So there is no chance of getting this infection either from water or from food, which is the only source of infection. So the chances of getting a typhoid nowadays is almost nil, what I feel. How to know whether you are suffering from a typhoid or not? The clinical features of a typhoid are, initially you will be having a fever. Again, this fever is step ladder type of fever. You don't get high fever. Suddenly you don't get high fever. So initially, if the temperature is 99, so by the evening or by tomorrow morning, it will be 100. The next day, it will be 101, 102, 103 like that. That means it keeps on increasing gradually. So first thing is fever. Second thing, gradually increasing fever. Second thing is headache. So very common finding is headache as well as abdominal pain along with the nausea and vomiting. So when these symptoms, that is the fever, gradually increasing fever, headache as well as the abdominal pain is there for more than 1 week, then only you must get this blood testing done. Other things what you must know is, if you have high fever, sudden onset of high fever, then it is 100% viral infection. It's not bacterial infection. It can't be typhoid So it will be viral infection. Don't undergo any investigations in case of sudden onset of high fever. Second thing is high fever along with the chills. Again, it's a viral infection. It is not a typhoid. So don't get tested. Third thing is high fever along with the joint pain, severe pain in joints, multiple joints with high fever. Again, it's a symptom of viral infection. Next is high fever along with the cold, along with the cough. Again, it's not a typhoid. In typhoid, you will not be having cold and cough. So fever with the cold and cough, again, it's a viral infection. You need not test for a typhoid. But most of the hospitals, when you go, especially the nursing homes with high fever, sudden onset of high fever, joint pain, tiredness, cold as well as a cough, in such case, they advise you to undergo investigations and they wrongly report you fake information, the fake report they will give as a typhoid. So my advice about a typhoid is if you have fever, especially sudden onset of high fever, avoid going to the hospitals. You can take medicine at your home. Simple paracetamol is enough. Along with the paracetamol, if you take a rest, whether it's a bacterial infection or it's a viral infection, it subsides within 2 to 3 days. So avoid going to the hospitals in case of fever. First thing. Second thing, especially avoid going to the nursing homes. So because in the nursing homes, they advise you investigations, they advise you admission not based on your disease, but based upon the availability of a bed in that hospital. So avoid especially going to the nursing homes in case of fever. Third thing is, as far as possible, avoid getting the blood test done in case of a fever. But if any of the hospital does the blood test and report you as a typhoid, then you must cross check it with another lab. Then avoid going to the hospitals which have their own lab or which are attached to any of these labs. Finally, fever is not a dangerous thing. It's our body response to suppress the infection. That is the bacterial or so viral infection. When our body temperature increases by 1 or 2 degrees also, the viral infection, the virus as well as the bacterial growth will be suppressed. So don't get panic even when you get an high fever. If you need a precise and scientific information about health, then only subscribe to our channel. Namaste.